rolling.
What, you may ask, is the leading cause of death in the United States? It's not murder or even cancer. It's cardiovascular disease, a group of illnesses that has to do with the heart and blood vessels. Since I'm majoring in biology in order to continue to med school, this is a very troubling topic to me. According to a website I accessed on July 14th, published by the Mayo Clinic, cardiovascular disease is the #1 killer worldwide of men and women. While there are many causes, there are also ways to prevent and treat cardiovascular disease. First, you need to know that this disease is a huge problem. According to the Centers for Disease Control website I accessed on July 13th, it causes more deaths in Americans of both genders and all racial and ethnic groups than any other disease. They also state that it costs approximately $300 billion a year in combined healthcare costs, medication bills, and lost productivity at work. The CDC has also found that people in minority groups and low-income populations have a much higher rate of heart disease. The second thing you should be aware of is that there are several risk factors associated with this disease, including both those we can and cannot control. According to the CDC, some of the non-controllable factors include age, gender, genetics, race, and environment. Studies by the Mayo Clinic suggest that men are much more likely to obtain this disease than women, and African Americans are twice as likely to attain cardiovascular disease as Caucasians. Meanwhile, the CDC states that there are also things that we can control, such as smoking, diabetes, high cholesterol, obesity, high blood pressure, physical inactivity, and stress. Lifestyle changes can be made to alter these factors and decrease the risk for heart disease. The third and most important point is that prevention can be achieved by removing certain causes. Michael Cownan states in his 1991 book, Preventing Coronary Heart Disease, Prospects, Policies, and Politics, that quitting smoking is one of the most effective ways to reduce the risk for cardiovascular disease. The CDC website says that lower cholesterol and blood pressure can be attained through simply having aerobic exercise and healthy eating habits in your lifestyle. According to Cownan's book, using less salt and consuming oily fish at least twice a week can help heart health. He goes on to say that the acid in fish oil may aid in the prevention of heart attacks, and that a diet that incorporates fruits, wine, and vegetables may increase life expectancy and reduce the risk for heart disease. Finally, you should know that cardiovascular disease is treatable if contracted. While treatments may vary depending on the type and severity of the illness, according to the Mayo Clinic website, lifestyle changes and healthy eating habits are essential to any effective treatment. Other treatments include blood pressure medications, aspirin, and statin cholesterol-lowering drugs. According to the Mayo Clinic, extreme cases may require surgery to reopen or replace damaged blood vessels. One of the most common surgeries to do so is called a CABG, or a coronary artery bypass and graft. In this procedure, veins or arteries are taken from another portion of the patient's body and are placed at the coronary arteries in order to bypass the narrowing blood vessels and improve blood flow to the heart. All of these treatments, however, are targeted to improve overall heart wellness and to increase life expectancy. Overall heart disease in its many forms is the most deadly disease of its time. According to the Mayo Clinic, it is responsible for over 40% of deaths in the United States, which is more than all types of cancer combined. Even though heart disease is the silent killer and has many causes, prevention and treatment are very possible. Understanding all the different types of heart disease will allow for a healthy lifestyle that will minimize risk. So, what are you doing to stop a run-in with this silent killer?